Thank you, Mr Speaker. My question is to the Minister for Health. I like science and I like facts. It's been over a year since the Standing Committee on Health, Aged Care and Sport made 23 recommendations following its inquiry into the state of diabetes mellitus in Australia. With obesity costing our health system around $12 billion a year, every year, and the rate of diabetes in Australia reaching crisis point, when will the government release its response to this inquiry and get on with the job of improving the health of Australians?
Call to the Minister for Health and the Minister for Disability and the NDIS.
Thank you, Mr Speaker, and thank you to the member for McKellar for the question, for the work that she has been doing on that important committee, and as I understand it will continue in this term on the committee chaired by the member for Macarthur and now deputy chaired by the member for Kooyong. That was a really impressive, ambitious report that I asked the committee to undertake because, as the member more than anyone in this place probably understands, this is one of the pressing public health challenges we have, driven in large part by poor diet, by rising levels of overweight and obesity. We're giving it very serious consideration. We'll provide a formal response in due course, but I do want to say, obviously, that we are responding to a number of those recommendations. In broad terms, a number of them go to food policy, and that is now being led by the terrific new Assistant Minister for Health, who has responsibility for that area, particularly in relation to food labelling. But also one of the recommendations from the report, as I recall, it goes to the dietary guidelines that we have in Australia that are being reviewed now by the NHMRC, as well as issues around marketing and advertising of unhealthy or junk food to children. And we have commissioned some work from, I think, the University of Wollongong to review that, and they are, I think, scheduled to deliver that work later this year. The report also contains a number of recommendations around access and affordability to cutting-edge technology and medicines. As you know, Mr Speaker, and as everyone here knows, we have now provided subsidised access to constant glucose monitoring, or CGM, for all 130,000 Australians living with type 1 diabetes. That has been an extraordinary advance for that group, but there are probably 10 times at least as many Australians who have type 2 diabetes. And a recommendation, a great debate through that inquiry, was whether those Australians might have, or some of those Australians at least, might have access to CGM. As the member probably knows, there are a couple of applications now before the Medical Services Advisory Committee to consider if and on what conditions access to CGM might be provided, subsidised through the MBS for type 2 diabetes patients. And I'm really looking forward to that advice. That, I think, is the appropriate next step in that phase. And also the inquiry dealt with the potentially revolutionary impact of GLP-1s, or often better known by their brand names of Ozempic, Mounjaro, Wegovy and such like. And I have asked the Pharmaceutical Benefits Advisory Committee to provide us with some specific advice about the ways in which those medicines might be rolled out in a manner that ensures social equity. I mean, they are available on private scripts now, but at quite a significant price. It may be $4,000 or $5,000 a year, which is well beyond the means of many communities of Australia, and I'm looking forward to that advice from